My name is Dr. Balu. I'm a consultant psychiatrist. I want to talk to you about a condition which has been very interesting for me in the recent past. I've been a psychiatrist for more than 20 years, and I've seen people with a condition called Attention Deficit Hyperactivity Disorder, or ADHD. Not so much in clinical practice for the last 15 years, I must say, although in the last 2 years we have seen an increasing number of people approaching us for a diagnosis of ADHD, or adult attention deficit hyperactivity disorder. So I have been thinking about what makes it more interesting now that more people are asking about this. There are many reasons. We know that about 3 people in 100 may have this condition, but they don't have a severe enough condition to seek help. But now that people are spending more time with themselves and also becoming more aware of some of these conditions, that they are wanting to seek help, which is a good thing. If you have any problems with your attention, focus, concentration, if you feel that you're hyperactive, doing many things in one go and not finishing tasks, and you're forgetful, and if others have commented that you've been impulsive, making rash decisions without thinking through them, and if these problems have remained with you for a long time, as far as you can remember, even as a child, which was picked up by your teachers and parents, probably they were not to a severe degree that they needed assessment at that time, but they've continued to impact your life adversely, you may have ADHD. It's a very common condition. Some scientists believe that it's a bit like the diabetes of mental health. It can be very silent, but it can affect multiple areas. The reason why I got very interested in this is I had a number of people during the pandemic approach me with these symptoms. They have been doing some online tests, but of course not all of them who have some symptoms have the diagnosis of ADHD, and that's why it's important to go through the symptoms very systematically with a professional eye and come to a decision if they have the condition or not. I must share some interesting anecdotes from some people that I have met recently. Most people who come to me are very high performing, they're very intelligent, they're very creative, but they find that their team finds them erratic, sometimes disorganized, and their spouses might find them very, very challenging to live with. Some of these patients that I've seen have turned to substances, sometimes drinking excessively or even using recreational substances to manage their emotions. One of the things that people very commonly talk about is high level of restlessness and anxiety, which can be the hyperactivity that we have in ADHD. The other important part of my job involves asking about people about their executive function, because I do see a number of people who are relatively high functioning in their area of work. And we recognize that many of these people have problems with executive function. And when I say executive function, it is mainly self-management, which includes self-regulation, self-monitoring, self-control, emotional regulation, impulse control, task initiation, organization, time management, planning, working memory, so on and so forth. So if you have issues with one of these domains or multiple domains, you should seek help straight away. You may wonder what happens when you don't seek help and how these symptoms will manifest. The commonest feature I find in most of these people is what we call as anticipatory anxiety, because most of my patients know what to do, but they're not simply able to do it. They have the intention, but are not able to implement their intentions. So I call it as a gap between intention and implementation. And this can be resolved. There are very good treatments for this. One of the interesting things I have also realized in the recent past is ADHD is probably the most treatable condition in mental health, and we have a very, very high degree of success, as high as 70-80%. of people respond well to treatment medications, therapy, coaching. I would also encourage you to carefully keep a record of some of your behavior. Ask your parents. If you can, go back to your teachers and school reports if you have any of those symptoms that I've been talking to you about. The management of ADHD takes multiple angles. You look at evaluation, which is important to get it done through a licensed specialist person who can help you, a professional. And you can educate yourself with a number of online resources. There are several books, podcasts. Of course, an intervention like medicines, psychotherapy, coaching helps. But it's also important to make the necessary accommodation around you to take care of some of your deficiencies and develop a sense of wellness and well-being within you by creating good routines, which allows you to balance between different competing priorities on your time, allows you to sleep well, eat well, and have time for exercise and for good relationships. So I've talked a lot about what I have been experiencing with my clients recently, and we have been getting a lot more people who are seeking a diagnosis of ADHD. But to recap, I would say ADHD in adults is much more common than you imagine. It can affect up to 3 people in 100. Many of these people may have had symptoms as a child, but they were not recognized. People do present with anxiety or depression as a comorbid condition. Some people have OCD. It's important to recognize this and treat so that you can get other symptoms resolved and live a productive life. Assessment process can be elaborate because it's important that we get a lot of information about you, your condition, behavior, and also get some reports from school and other people around you. You may be prescribed stimulant medication which can affect your physical health, hence some blood tests and ECG might be required. But we try and make it as seamless as possible for you and get you on a treatment path as soon as we can. So please don't neglect this, and this is a condition which affects your executive function. I would say finally that try and be your own executive officer, your own CEO. It's time to take control of your life, and if something is getting in the way of you managing your life and taking control, it could be an undiagnosed ADHD. Speak to a licensed health professional to know more and get yourself assessed.